And this is kind of our hygiene hall that used to be bustling.
Dr. Pete Appleby loves people, which is why he became a dentist. But recent years have seen a shift in how many people his branch of Virginia Family Dentistry can see.
The hygienists that are here are working harder than they've ever worked, but unfortunately we just don't have enough staff to fill the operatories we have. So.
If you notice it's hard to get a dental appointment recently, it's likely tied to the shortage of dental hygienists in Virginia.
We really practice a preventative model, so we want to see our patients regularly, and dental hygienists are really what enable us to do so. So having a shortage of dental hygienists means we have a shortage of appointments to see those patients, and that does have some serious effects.
Hygienists are licensed professionals, and one dentist can supervise up to 4 hygienists. According to the Virginia Dental Association, half of all dentists report taking on tasks usually done by hygienists in the past couple of years.
I think I laugh with a lot of my dentist friends that we're doing more cleanings than we've ever done in our whole career.
This limits the number of patients a given dentist can see each day, and on the whole, it means healthy patients have to wait longer in between visits. This is one of the hygiene rooms here at Virginia Family Dentistry. The reason they're letting me sit in this chair is because this room hasn't been used in a long time. They don't have the staffing to put a hygienist in here.
We are seeing about 1,500 fewer cleaning appointments per year, and yet the demand is actually up.
There's a workforce imbalance in Virginia, where in many places there are more dentists than practicing hygienists. The problem is particularly pronounced in Richmond and Henrico, according to the Virginia Dental Association survey. In Virginia, only Fairfax County has a larger gap between the number of full-time dentists and the number of full-time hygienists.
It has been tough.
The Virginia Dental Association sees a few ways to address the problem. Virginia is one of 7 states to join a compact where a hygienist license will easily transfer between states. The VCU School of Dentistry is one of the main dental hygienist programs in the Commonwealth, but their leadership says they need a new building to expand it. Leaders are hopeful the state budget will include funding to start that project. Plus, industry leaders are finding ways of attracting more students to dental hygienist programs.
Again, it's great hours, fantastic pay, weekends off, you're home at night.
For those reasons, Dr. Appleby says dental hygiene is a great career and thinks these efforts will work.
As a patient myself, we all have to understand that it's going to take some time. So in the meantime, I do think one of the better things to do is also for patients to consider being an advocate for themselves in getting those appointments and being proactive in seeing their dentist, not just sort of maybe accepting I'm going to not be seen for 12 months.
Appleby says he gets the frustration for patients and suggests asking about possible same-day appointments with your dentist. Plus, there are plenty of dentists around.
So if you have a problem with your teeth or gums, something that's concerning you, don't wait if your dentist is telling you they can't see you for a year, 18 months. Be proactive with your health, contact us, and most dentists are going to make a way to see you.
In Chesterfield, Jake Burns, CBS 6 News.